Britain is in the grip of its worst flu season in a decade. The UK has cut funding to the National Health Service in recent years, and there are mounting concerns over the future of the country's public healthcare system and its staff.
The NHS has been under-resourced, underfunded and kind of neglected, taken for granted for a long period of time, and that attitude and that culture needs to change.
The UK's National Health Service is facing what some say is its worst crisis in its history. Hospital trusts like this one and ambulance services across England have declared critical incidents in recent days, and waiting times at accident and emergency departments are at an all-time high. Just last month, data revealed 1 in 4 ambulance patients in England waited more than an hour to be transferred to hospital, and 40% of patients waited at least 30 minutes to be transported to accident and emergency.
It's undeniable the impact of COVID and the pandemic on how we interacted with patients or interact with patients. We suddenly went from a face-to-face model, all face-to-face, people coming in, to a significant reduction in face-to-face patient appointments.
Outpatients like Miracle know this all too well, and after detecting a growth on her thigh, she was adamant to have this assessed by a doctor.
Sad talking about it, because after I lost my mum to breast cancer, in my head I was just like, I don't want anyone else around me to go through the same thing, and it just seems like that came on so quickly on me as well, and I didn't know how to deal with it.
Miracle says she made numerous efforts to have the growth looked at, but it wasn't taken seriously.
I go to the A&E, the urgent care centres. I have to wait 10 hours to see a doctor. It took a whole year to just get an appointment. It was scary because I don't know how much longer, if I didn't push or pressure them to get me someone to look at this, I don't know how long it would have taken for them to look at this. And this could have easily killed me.
Miracle's story is similar to many across the UK. And despite hundreds at risk of dying weekly, the UK government has been criticised as not prioritising its citizens' health. Prime Minister Rishi Sunak has pledged to make changes.
You should know we're taking urgent action, increasing bed capacity by 7,000 more hospital beds and more people cared at home, providing new funding to discharge people into social care in the community, freeing up beds, and the NHS are working urgently on future plans for A&E and ambulances.
This month will see more strikes by nurses and paramedics, with no sign of the government opening negotiations. Lape Olarinoye, TRT World, London.